Hello, Mr. Rouse.
Yeah.
Dr. McDonald, nice to meet you.
Hi.
We've not met before. I understand you've been.
No.
You came in on Friday and were looked
Yeah.
after by the on-call team over the weekend. How are you getting on from the point of view of your kidney infection? Is that you came in with some nausea and vomiting?
Yeah,
is
no,
that
much
better?
better. Yeah, good. I had something to eat last night.
Good.
So good.
Any more fevers or?
No. I tell you what I have had, and it's just really quite strange.
Right.
I'm getting a real ringing in my ears.
Right.
To the extent, last night when my wife visited, I could barely hear what she was saying.
Right.
And then my sleep last night was like it's difficult to sleep.
Can you hear me talking to you now?
Yeah,
or
with
is it,
with real difficulty though. To be honest with you, it's I'm just kind of assuming it's a general kind of drug side effect or something.
Well, you've been on some very strong intravenous antibiotics over the weekend, and that's partly what I've come to talk to you about as well.
Yeah.
And I'll talk about your ringing in the ears in just a moment. If there's anything you can't hear me say, do mention it, and I'll speak up.
Would, yeah.
I'm glad you feel better from the point of view of the nausea and the vomiting. That's a very common symptom of pyelonephritis, and as I said, the treatment for that is strong intravenous antibiotics. And one of the medications you've been on is something called gentamicin, which is a very strong antibiotic.
Yeah.
And it has to be monitored quite closely because there's a danger that the level in your bloodstream can get a little bit too high. And the way we do that, as you know, you've been having blood tests over the weekend, so we send them off to monitor and make sure the gentamicin level is just between the high dose, which would be a toxic dose which has side effects, and a low dose which would be ineffective. So we try and get it just right.
Yeah.
And looking through your notes today, I've seen they've been doing that, and they sent that off, and we had a level back on Saturday, I think, that was actually a little bit high.
Right.
What we'd normally do in those circumstances is stop it and not give you another dose.
Yeah.
But looking over your notes and your drug charts, it looks like you still got a dose anyway.
Okay.
And this was a mistake. This
Okay.
was an error. One of the consequences of that we've noticed on your blood tests is, and one of the known side effects of having too much gentamicin in your system is that your kidneys can be a bit impaired. And that's what I came to talk to you about.
Okay.
Was that we'd noticed that your kidney function has got a little bit worse. Now, that could be a result of the infection.
Yeah.
But because you're feeling better and so on, I imagine it's not. I imagine it's probably more likely to be a result of having too much gentamicin in your system now.
And this is because basically someone's given it to me when I shouldn't have had it, right?
I'm afraid that's right. But on the whole, and in the vast majority of cases, the kidney damage is reversible to the extent that your kidney function will get back to normal once we've stopped the medication. We stopped the dose.
But hang on. So there's a possibility that there's permanent damage to my kidney because of this.
In the vast majority of cases, people who have a slight rise in what we call their creatinine, which is the way we measure your kidney function, when you stop the medication, if your level's been a bit high, it goes back to normal in the vast majority. There's a very, very small chance that you might have some long-term impairment, but it's really unusual.
And all this because someone gave me something which
I'm afraid we don't know at this stage because it's not been fully investigated. That's something we're going to do right away.
How can something like that happen?
It's
it's just human error. I mean, literally, it says do not give this, and they've given it.
It could be. It's difficult to know at this stage
who
made the error and how.
You're telling me though that 9 times out of 10, any kidney damage isn't permanent.
Yeah. So I think it's also hard to tell whether it might be related to the infection as well. So
I'm just surprised that someone can make such a.
Well, it's common for a level to come back high, but then it should be stopped. So the fact that your levels are high in the first place is sometimes unavoidable. It's just the differences in one person's response to a drug and another. But then you should not have got another dose, and I apologise for that because it looks like it may have caused at least some transient impairment of your kidney function.
But let me get this right. But you're saying that there's going to be no permanent damage.
In the vast majority of cases, most people's kidneys will recover, and we'll be doing more tests over today and the next day to make sure that's happening.
So I should know within the next day or two whether there's.
Absolutely.
Right. Okay. That's a bit.
I wasn't expecting that. I can understand it, and I do apologise for that. It's definitely a mistake and we will do our best to investigate it and find out.
Right,
why it's
okay, well,
happened.
good, yeah.
The other issue is that I wasn't aware of is you've been having difficulty with your hearing
Yeah.
for the last 24 hours, and that can also be linked to this drug level being high. So it can sometimes cause some impairment of your hearing function.
Okay, but this is only temporary?
Well, with hearing damage, there is a higher chance, I'm afraid, than with the kidneys that might be more long-lasting, or that you might not recover full hearing. But first of all, we need to make sure that we know whether or not you've had any damage to your ears, which...
well, I can tell you I have had damage, because this ringing's really... Well, hang on, I'm confused. So you're saying that the... Is it temporary? What I'm getting at the moment, is this temporary?
Well, one of the side effects of gentamicin levels being high is that you can get damage to the ears.
Right, but is it
and
temporary?
I'm concerned now you've mentioned that you have this
hang on,
tinnitus.
buddy, is it temporary?
So I think that in some cases, yes. So it will come back, it will resolve by itself. But in other cases, there are cases of people who've had damage to their ears and their hearings from this that's long lasting, and I'd be very keen to get on and make sure that we can investigate your hearing and see what's happened there.
So there's a possibility that I might be stuck with this.
There's a small possibility, yes, that there may have been some lasting damage to your ears from this error.
Do you have any? I don't know if it's on my notes, but do you know what my job is?
No, I don't think I've read in the notes.
Right, I'm a sound engineer.
Right.
This is... I can't really believe this is happening. Seriously, because of some idiot giving me something, not only is there some sort of liver damage, which you're saying is probably going to be okay. Right, hang on, can I just check this out? You're telling me that this hearing thing is actually, it's more likely that this could be permanent.
I mean, I knew about your kidney impairment, or rather the liver. I knew that there's been some impairment of the kidney. It's what I came to talk to you about today, and that it might be related to this drug error.
But the hearing, you're telling me there's a possibility, a larger possibility that my hearing could be affected.
There's definitely a possibility from this error that it's resulted in some damage to your ears, I'm afraid.
I'm astounded. But I've just come in here to be treated, and I'm leaving with... I'm a sound engineer, as I say. I can't do my job if I'm, any impairment to my hearing, let alone... This is chronic. I mean, I'm finding it difficult to well, I couldn't hear my wife. I'm finding it difficult to hear you.
Yeah.
And all this is just because of some idiot has misread a chart.
I understand why you're angry, and it's completely appropriate, and an error is being made, and we're going to do our best to find out why that's happened, to stop it happening.
Yeah, well, I want to know why this has happened. And I can't... So you knew about this when you come to see me. This is obviously something that you've been aware of.
This is what we realised today, is that there's been this.
At what stage were you aware of this?
We've only just become aware of it, so we weren't aware over the weekend. Obviously, that's why that's why you had a dose when you shouldn't have done. And looking through your notes, just before I came to see you, I became aware that you'd had this dose. So we've come to see you right away about it.
I just can't believe that I've come to this place to be treated, and I'm going to be leaving worse than when I came in because of some bloody idiot not reading a chart properly.
I understand that, and
I've got a mortgage. I've got a family.
Yeah.
No, hang on a second. I'm absolutely shocked by this. This is completely... I mean, do you know the individual concerned who's actually done this?
Well, we don't at this stage, so we're going to find out...
Would it be a doctor? Would it be a nurse? What are we talking here?
We don't know whether it's someone who wrote up the drug or gave a drug when it was crossed off, or we don't know the details of that, but we will find out, and I can assure you, along the way, we'll be completely transparent with you about what happened.
Right, well, listen, buddy, I can assure you one thing, that if this is permanent, then I have no choice but to I don't know, to go to court or something.
No, I understand.
I can't work if I can't hear. And that's kind of by the by as well. This is just, I'm leaving physically impaired because of some idiot's mistake.
As I said, there's people who have ringing in their ears when they have this medication or have high levels of medication. It's very difficult to predict who will get better and who won't. There's a very good chance that your symptoms will resolve entirely. And
what, over time? Well, I can't afford to take a month off work if it suddenly gets,
Well, the only way to make any kind of reasonable prediction about that is to first of all make a proper assessment of whether there's been damage, and if there has been damage, how much there is. So I don't want you to come away from this thinking that your ears are definitely permanently damaged.
Well, that's
forever,
what
and
I'm
there are
getting from you.
consequences.
That's what I'm getting from you.
But I understand that that's your major anxiety, and in the issue of seeking compensation or anything like that, none of that will change our obligation to you to find out exactly what's going on, and the fact that we'll update you completely transparently about what's happened up until this point from here on. But our priority has to be to try and work out, has there been damage to your ears? How much damage has there been, if there has, and to get an opinion about whether that's likely to be.
And when's this going to start? I mean, this needs to be started today.
Absolutely. This will be started today, right away.
I'm at a loss for words, seriously. I'm just absolutely... Is that person working here today?
Again, as I say, I can't be sure that this is a single individual responsible. So,
yeah, and also, whilst I'm here, are they going to be one of the people that are caring for me? Because I feel uneasy sat here now that, you know, possibly losing my hearing because of someone's actions, when they're going to be here caring for me now. Well, I
understand that.
Who do I talk to about this?
We've stopped your medications anyway, and that's the first thing we've done to stop any further damage occurring. So from that point of view, there shouldn't be any risk of further damage as a result of gentamicin because we've stopped it. In terms of whether an individual is responsible or not, I think what's much more likely is that this is a problem of process and procedure. So our procedures are supposed to be designed so that this thing just can't happen.
Yeah, well, it has happened.
And it has happened, so it means that there's something wrong procedurally, and we need to identify exactly what that is and change it, and that will be done right away. Okay? But the first part of this process is obviously explain to you what's happened and how it is. And I know that's not a consolation for what's happened, but I want to assure you that we're going to be open and transparent about working out what's happened, find out exactly whether there's been any damage to your ears or not, and then getting an opinion from a specialist, from an ENT specialist, about whether that's what kind of predictions we can make about how it's likely to improve. And of course we will monitor it as well with time. My hope is that the ringing in your ears is temporary and it will resolve now that the drug's been stopped.
In your opinion, in your medical opinion, is it going to be temporary or is it going to be permanent?
There are cases of people who've had permanent damage from this kind of toxicity from this drug. There's no doubt.
But in terms of kind of like statistically, is there more of a chance of it being permanent or more of a chance of it being temporary?
Hand on heart, not as an ear specialist, I don't know the answer to that. I don't know the statistics on that.
Well, can you make sure that today I speak to someone that can give me the answer to that?
Absolutely. Absolutely.
Because you can have no idea of the ramifications this can have in my life.
I understand that with your line of work, that must be a real anxiety. But as I said, I don't want you to leave this thinking it's definitely your ear hearing is definitely going to stay like this, because we don't know that. And we first of all need to work out exactly what's happened.
I can barely hear you now. It's just I can't believe this. I just really, and it's not. I don't mean to be. I don't know what to say.
So, from the point of view of kidneys, we'll monitor your kidney function over the next few days. We'll get your hearing assessed right away, and we'll get you seen by a specialist right away to work out what's happened. And I know it's no personal consolation, but we're doing everything we can to make sure this kind of mistake doesn't happen again.
Okay.
I will arrange for you to talk to someone more senior about it.
Yeah, I want to speak to someone more senior straight away.
And you mentioned also making a complaint, and I think that's an important part of this process and a valid one. So we can put you in touch with the Patient Advice Liaison Service about how to go about that.
Okay.
Once again, I'm very sorry this has happened, and I understand all the anxiety it's caused you. We'll do our best right away to get on and work out exactly what's happened and why, and to work out what it means for you. And my great hope is that it won't have any lasting damage. I'm very positive about that. Your kidneys are very optimistic about that your kidney function will return to normal. And I'm very hopeful that also your hearing impairment won't be significant, but we have to find out right away, obviously, and we'll do that straight away.
Okay.
I'll come back and see you as soon as we've made arrangements for the first round of investigations.
Okay.
And once again, I'm sorry, Mr. Rouse, and I'll keep you updated. In this scenario, you've been asked to tell a patient that there have been some errors made as part of his investigations or management, and to explain the consequences to him. This is always an emotive situation. In addition, in this scenario, you are hijacked by new information not given to you about the fact that the patient's also been experiencing some possible ototoxic consequences of his gentamicin, as well as the nephrotoxic consequences you're already aware of. And for a sound engineer, this is obviously a devastating complication. It's important then to recognise that the likely outcome of this consultation, or expectations for how things will be left, shouldn't be pitched too high. It's very unlikely that by the end of the consultation he won't be angry and upset. So be aware that sometimes in the PACES communication skills scenario, it's unrealistic to expect consolation by the end of the interaction with the actor or the patient. The key things that you need to do in this scenario is explain in a very open and transparent manner what's occurred and that it is a mistake. It's crucial that you apologise. It's also very important that you don't discourage a formal complaint or any hints that the person might make at litigation. The other key thing to do is to try, if you can, to take the emphasis away from what has occurred and to what will be done about it. In this case, it's very key to work out exactly whether there's been any auditory impairment, and also to seek a specialist opinion to determine what the likely prognosis is, which for him would be critical to his career. It's also very important that you make some sort of indication that you're aware of the clinical governance issues about trying to work out why the mistake has occurred and what can be done to prevent it in the past. Now, on a personal level for the patient, that's not necessarily very reassuring, but it's very important to indicate that you're aware that that's an important process, and it's likely that the questions that will follow after the scenario from the examiners will be along those lines.